Hi, I'm
Picture
Dr.
this
Ellis. Today
scenario
I'll show
for
you a
just a
simple
moment.
3-minute technique
You're
for
home
seniors.
alone,
It's
maybe
quick,
watching
easy,
TV
and can make
or
all the
reading a
difference.
book, when suddenly your face feels strange and your arm goes weak. Your words start slurring when you try to call for help. You're having a stroke and nobody else is there. This terrifying reality happens to thousands of seniors every single day, and here's the shocking part that most people don't know. A groundbreaking study from the American Stroke Association found that nearly 40% of stroke victims over 60 are completely alone when symptoms first strike. But here's what's even more incredible. Research from Johns Hopkins Medical Center discovered that seniors who knew exactly what to do in those first critical minutes had survival rates that were 70% higher than those who didn't. Think about that for a second. 70% higher survival rates just from knowing what actions to take. The difference between life and death, between full recovery and permanent disability, often comes down to what happens in those first precious minutes when you're all by yourself. And while I'm going to share 7 potentially life-saving tips with you today, the number one tip is so powerful that neurologists at Cleveland Clinic found it increased the chances of getting life-saving treatment by nearly 300%. This one simple action, which takes less than 30 seconds to execute, could literally mean the difference between walking out of the hospital or never walking again. Before we begin, tell us in the comments now your age and where you're watching us from. We're reading and replying to every single comment, so drop your comments below. Now, without any further ado, let's get started. Number 7. Create your emergency contact system before you need it. Let's start with something that seems basic, but could save precious minutes when every second counts. Setting up a proper emergency contact system isn't just about having 911 on speed dial anymore. Modern technology has given us incredible tools that most seniors aren't taking advantage of. Research from the University of California, San Francisco tracked over 2,000 stroke patients and found that those with automated emergency systems got help an average of 14 minutes faster than those relying on traditional phone calls. 14 minutes might not sound like much, but when brain cells are dying at a rate of 2 million per minute during a stroke, that's 28 million brain cells saved. The most effective system starts with your smartphone if you have one. Both iPhone and Android phones have emergency features that let you call for help without even unlocking your phone. On an iPhone, rapidly pressing the side button 5 times triggers emergency SOS. On Android phones, pressing the power button 5 times does the same thing. But here's what most people don't know. You need to set this up beforehand and add your emergency contacts. The system can automatically send your location to chosen contacts and even share your medical information with first responders. Beyond your phone, consider getting a medical alert device that you actually wear. The key word here is wear, because that device sitting on your nightstand won't help when you're in the kitchen. Modern devices can detect falls automatically, and some even monitor irregular heartbeats that might signal an impending stroke. The American Journal of Emergency Medicine published research showing that seniors with wearable alert devices were 3 times more likely to get help within the golden hour after stroke symptoms began. The best part is that many of these devices now work through cellular networks, meaning they function even if you're gardening in the backyard or taking a walk around the neighborhood. You should also create what emergency responders call a vial of life. This is a simple container with all your medical information, medications, allergies, and emergency contacts that you keep in your refrigerator. Paramedics are trained to look for these, and having one can save critical minutes when you can't speak for yourself. Include your doctor's name and number, a list of all medications with dosages, any allergies or medical conditions, and insurance information. Make sure to update this every 3 months or whenever your medications change. Number 6. How to stay conscious and alert. Now let's move to something that might surprise you about stroke survival when you're alone. The ability to stay conscious and alert during a stroke isn't just about willpower. It's about knowing specific techniques that can help maintain blood flow to your brain. Researchers at the Mayo Clinic studied over 1,500 stroke patients and found that those who remained conscious for the first 30 minutes had significantly better outcomes, with 65% achieving full or near full recovery compared to just 32% of those who lost consciousness early. The first technique is controlled breathing, but not the deep breathing you might expect. During a stroke, taking slow, shallow breaths can actually be more beneficial than deep ones. The reason is fascinating. Deep breathing can sometimes lower blood pressure too much when your brain desperately needs blood flow. Instead, focus on steady, rhythmic breathing at about 12 to 15 breaths per minute. Count them if you can. This counting serves two purposes. It regulates your breathing and keeps your mind engaged and active. The second technique involves physical positioning, and this is crucial. If you feel a stroke coming on, don't lie flat on your back. Research from the University of Texas Southwestern Medical Center found that keeping your head elevated at about 30 degrees optimizes blood flow to the brain while preventing aspiration if vomiting occurs. If you're in bed, prop yourself up with pillows. If you're on the floor, try to lean against a wall or furniture. The study followed 800 stroke patients and found that those who maintained this position had 23% better oxygen levels in their brain tissue. Here's something else that's incredibly important. Keep your eyes open and focused on a fixed point. This isn't just about staying awake. Visual focus actually stimulates multiple areas of your brain and can help maintain consciousness. Pick something specific to look at, like a clock or a picture, and concentrate on its details. Describe it to yourself mentally or even out loud if you can. This mental engagement activates neural pathways that might otherwise shut down during a stroke. Before we continue, if you have been enjoying the video so far, hit that like button so more seniors can see it, and subscribe. We've got more powerful senior health tips videos coming every day, and you don't want to miss the next one. 5. Know which medications could save or sabotage you. That medicine cabinet in your bathroom might hold the key to surviving a stroke, but it could also contain things that make it worse. This is where knowledge becomes absolutely critical. Let's talk about aspirin first because there's so much confusion around this. If you're having an ischemic stroke, which is caused by a blood clot, and accounts for 87% of all strokes, chewing a regular aspirin can be beneficial. The key word here is chewing, not swallowing. Chewing gets the aspirin into your bloodstream faster, sometimes in as little as 5 minutes compared to 30 minutes for swallowing. But here's the critical part that could save your life. Never take aspirin if there's any chance you're having a hemorrhagic stroke, which is caused by bleeding in the brain. Taking aspirin during a hemorrhagic stroke could be fatal. So how do you know which type you're having without medical equipment? You can't be completely certain, but there are clues. Ischemic strokes often develop gradually over minutes or hours, while hemorrhagic strokes typically cause sudden, severe headaches that patients describe as the worst headache of their life. If you have that thunderclap headache, never take aspirin. Now let's talk about blood pressure medications, because this gets complicated. If you're on blood pressure medication and you're having stroke symptoms, don't take an extra dose thinking it will help. Your blood pressure actually needs to be somewhat elevated during a stroke to push blood past the blockage or to areas where vessels are damaged. Studies from the International Stroke Trial showed that aggressively lowering blood pressure during acute stroke increased negative outcomes by 42%. Here's what many people don't realize about their regular medications during a stroke. If you take blood thinners like warfarin or newer drugs like Eliquis or Xarelto, this information is crucial for emergency responders to know immediately. Keep a card in your wallet and a note on your phone's medical ID stating you take blood thinners. Number 4. Use your voice while you still can. Let's talk about something that might save your life in ways you never imagined. Your voice during a stroke is more than just a way to call for help. It's actually a powerful tool that can help preserve brain function and alert others even when you think you're alone. Neuroscientists at Stanford University made a remarkable discovery when they studied 1,200 stroke patients. Those who continued attempting to speak, even when words came out garbled, maintained better brain oxygen levels, and had language recovery rates higher than those who stopped trying to talk. The moment you notice stroke symptoms, start talking out loud immediately. Describe what you're feeling, what time it is, what you were doing when symptoms started. This serves multiple crucial purposes that could save your life. First, the act of speaking activates multiple regions of your brain, increasing blood flow and potentially preserving function. Second, if you have any smart devices in your home, like an Alexa or Google Home, Continuously talking increases the chance these devices will activate and could potentially be used to call for help. But talking here isn't just about words. Making any vocalization, even groaning or humming, can help. These sounds can alert neighbors in apartments or attached homes. So keep making noise even if words won't come. Tap on walls, especially in apartments where neighbors might hear. Use your voice as a beacon. If you can manage it, call out the time periodically. Say something like it's 2:15 and I'm having stroke symptoms. Then 5 minutes later, say it's 2:20 and I still need help. This creates a timeline that's incredibly valuable for emergency responders and doctors. The exact timing of symptom onset determines which treatments you can receive. The clot-busting drug TPA, for example, must be given within 4.5 hours of symptom onset. Number 3. Position your body for maximum survival. Now we're getting into the really critical information about body positioning that could determine whether you survive. The position of your body during a stroke isn't just about comfort. It's about maximizing blood flow to your brain while minimizing the risk of complications that kill thousands of stroke victims every year. Research from the Australian National Stroke Foundation, studying 3,000 patients, found that proper positioning in the first hour reduced secondary complications by 67% and improved survival rates by 41%. If you're able to move when stroke symptoms begin, don't try to walk to your bed or couch if you're already on the floor. The risk of falling and causing additional injury is extremely high. Instead, focus on getting into what neurologists call the recovery position, but with a specific modification for stroke victims. You want to be on your side, specifically your left side if possible, with your head slightly elevated and your affected arm supported. This position does 3 critical things. It prevents your tongue from blocking your airway, it reduces the risk of aspirating if you vomit, and it optimizes blood flow to both hemispheres of your brain. Here's exactly how to get into this position safely. First, if you're sitting, lower yourself to the floor using furniture for support. Don't try to control a fall, instead guide yourself down gradually. Once on the floor, roll onto your left side, unless your left side is the one affected by the stroke, in which case use your right. Bend your top knee to 90 degrees and place it on the floor in front of you for stability.